You probably heard about this pill. It gets called a wonder drug, and some people are even looking at it for anti-aging. But man, is there a lot of misinformation out there. So today, we're going to separate the real facts from the myths about the world's #1 most prescribed diabetes medication, Metformin. Just get a load of that number. Over 150 million people. That's how many people take this pill every single year. It's just a mind-boggling figure, and it really tells you how critical this one little pill is to global health.
So what's the real story here? Is it this game-changing drug with all these amazing benefits beyond just diabetes? Or are there some hidden risks and side effects that we really need to be talking more about? Well, that's exactly what we're going to break down, piece by piece, in this explainer.
Okay, so here's our game plan. We're going to start with its amazing history, then dive into the science of how it actually works. After that, we are going to tackle the side effect concerns head-on. Then, we'll explore some of the surprising benefits that go way beyond blood sugar, and finally, we'll help you figure out if this drug might be a good fit for you.
All right, first up, let's talk about where this thing even came from. Because what most people have no idea about is that this modern medical powerhouse actually has some really humble and pretty surprising natural origins.
So get this, Metformin's journey started way back in the 1920s. It was actually derived from the French lilac plant, which, believe it or not, had been used in folk medicine for centuries. It was first used in humans in France in 1957, finally got approved in the US in 1995, and has now built up this incredible safety record for over 60 years. So, what is it really? Well, putting it simply, Metformin is a pill that helps get your blood sugar under control in two really smart ways. First, it kind of tells your liver to chill out and stop making so much extra sugar. And second, it helps your body use the insulin it already has way more effectively. And the best part? Since it's generic, it's incredibly affordable. We're talking just pennies a pill.
Now let's get into the nitty-gritty of how it actually works inside your body. And I promise we're going to keep this super simple. It really all comes down to this clever three-part strategy.
So here's the breakdown. Number one, it quiets the liver. You see, for a lot of people with insulin resistance, their liver just dumps way too much sugar into their blood, especially overnight. Metformin basically tells it to knock it off. 2, it boosts insulin sensitivity. This means your muscle cells get way better at hearing insulin's signal to pull sugar out of your blood. And 3, it has a smaller effect of reducing how much sugar you absorb from food in your gut.
And here is the absolute key to why Metformin is so safe. And this is a big one. It doesn't squeeze your pancreas, forcing it to pump out more insulin. No, it just helps your body use its own insulin more efficiently. This is a huge advantage because it means Metformin, on its own, has a very low risk of causing your blood sugar to drop dangerously low.
Okay, time to talk about the thing that probably brought you here, the side effects. Let's just face this #1 concern head-on with total transparency and, most importantly, with the facts.
Let's really put these risks into perspective. By far, the most common issues are stomach-related, hitting about a quarter of people when they first start. Now, long-term use can lead to a B12 deficiency, but that's manageable. But what about that really scary one you read about online, lactic acidosis? The truth is, it is incredibly rare, and it almost exclusively affects people who already have severe kidney problems.
So what do you do about those common gut issues like nausea or an upset stomach? Well, the great news is there are proven solutions. The strategy is super simple. Start low and go slow. You start with a low dose and gradually increase it. Always take it with food. And if you're still having a tough time, ask your doctor about the extended release or ER version. It's way gentler on the stomach. And this brings us to the single biggest myth we absolutely have to bust right now. So many people worry that if they feel a bit sick in that first week, that's just how they're going to feel forever. But that's just not true. The reality is, for the vast majority of people, those initial stomach issues either get a lot better or they disappear completely within about 2 to 4 weeks. Your body just needs a little time to adjust, so patience is really key here.
All right, so we've tackled the risks. Now let's switch gears and talk about why doctors have so much confidence in this medication. And a big part of that is because the benefits often go way beyond just controlling blood sugar.
And honestly, the list of extra benefits is pretty impressive. One huge study showed it led to a 39% reduction in heart attacks. Plus, unlike a lot of diabetes drugs that actually cause you to gain weight, Metformin is either weight neutral or can even lead to a modest loss of a couple of kilograms.
And on top of that, there's some really exciting research going on, like the TAME trial that's looking into its potential anti-aging and even cancer-fighting properties.
So after all that, we get to the big question, right? Who is actually the right person to be taking metformin? Let's get practical and break it down.
Okay, so metformin is the go-to, first-choice medication for most people with type 2 diabetes. It's also really useful for people with high-risk prediabetes to help stop it from turning into full-blown diabetes, and it helps manage insulin resistance and conditions like PCOS. But it's definitely not for everyone. It should be avoided by people with severe kidney disease or those who drink heavily, and you also have to stop taking it for a bit before you get certain medical scans that use contrast dye.
Here's a little pro tip to help you get the absolute most out of it. Make sure you take it with a meal. Taking it with your dinner is especially good for tackling that stubborn high blood sugar you see in the morning. And here is a critical warning. Never, ever crush or chew the extended-release tablets. If you do that, you completely destroy their slow-release magic.
So how can you tell if it's actually working for your body? Well, the key is to track your data. When you can actually see your glucose patterns, you see exactly how the medication is affecting you. In fact, tools like Health Gheware can help you and your doctor see how the timing of your dose actually correlates to your glucose response, which makes for way more productive conversations.
So, let's wrap this up with the key takeaways. Number 1, metformin is incredibly time-tested, with a safety record that goes back over 60 years. Number 2, its real genius is that it helps your body use its own insulin better without making you go low. 3, side effects are real, but they're almost always temporary and manageable. And number 4, it offers powerful benefits beyond blood sugar, especially for your heart.
So we're going to leave you with this question. Now that you're armed with the real facts and you can separate the myths from the reality, I want you to think about this. What is the single most important question you are going to bring to your next doctor's appointment about metformin?
And of course, as always, please remember this is all for educational purposes. You should always talk to your own healthcare provider before you start, stop, or change any medication.